everyone should be entitled to health care. Yeah.
Opinion on it, neither here nor there. Some don't use health care.
Everyone should have health care. Government subsidized health care.
Yeah. It seems like we should be able to have the opportunities that their government has. Purchase their health care.
So you support having the same health care that the politicians have?
Absolutely.
The public option that is under discussion right now? Or?
Like, what do you mean?
Have you heard about the healthcare debate?
No.
Well, the healthcare debate, the direction of the healthcare debate is kind of erroneous to me.
So you would support a public option?
If it was more a public option, then I would probably take more stock into go taking care of myself and taking care of my health care. But since it's not more of a public option, it's just like mainly for the people that have the money. Basically, the haves have, and the have-nots have not. You know, and I'm a have-not, so I don't care about it.
I think that it's a lot of just, people speculating on things that would happen and trying to scare people away from it. I don't think that anything that anyone's brought up has really been a reason to not go forward. It's just delaying it more. I think it should have already happened, actually.
Yeah.
Yeah.
It's important. I just want health care. My husband just went to the emergency room and it was like $2,000.
Ouch.
Yeah.
Does your husband
And
do for a living?
he's in school. Oh yeah, he's a paramedic. Doesn't have health care.
Healthcare provider.
Yeah.
He does not have
He's
healthcare.
part-time and they don't offer
Yeah.
part-time.
As college students right now, do you have health care?
Only what the school offers.
Yeah.
As additional, no, I can't afford it. It costs too much.
Yeah, it does.
I
have That's a lot.
Yeah.
Okay.
I'm okay on it.
Is that working? Have you used that?
I've
service
used it a
before?
lot. I've
Yeah.
used it a lot. I've had it for quite a few years.
Have you been pretty happy with it?
Yes, I have.
Yeah?
Yeah, I've been extremely happy with it. It's good. I feel that a lot more people should be entitled to, if they don't have jobs, they don't have the income, they have children, whatever, should be able to get onto it. Especially children. I think everybody should have insurance. Or at least be offered it in some way. At a decent price.
Trying to do something to better ourselves and better those around us, and we're getting sort of the short end of the stick here.
Yeah.
I can understand if you want to give somebody the short end of the stick, give it to those people out there that have the insurance and can get the food stamps, but they're not willing to go work. They're not willing to even go to school. Come on, you've got options. They just don't, Ma'am, you got a quarter? Ma'am, you got $1? Hey, I'm sorry, man, I'm going to school. I ain't got no money for you.
Yeah.
I got to go to the store and spend $20 for food for the next 2 days. Sorry.
I work full-time to keep health care, so I can only go to school part-time because of health care.
Yeah.
I would be a full-time student otherwise.
Yeah.
People are making a lot of excuses, and people who are against health care have health care. They have government-subsidized health care. They are hypocrites. They are on a socialized medicine plan.
Yeah.
And they are against the socialized medicine plan.
They're all
It
the
makes
ones
no
that are
sense.
making the money that they could pay for it if something did happen. Like, none of us can. I don't have $2,000 in the bank to pay for it.
We use over 3,000 different types of foods and plants in the evolution and progression of human civilization and society. Okay, but from the agrarian age to the industrial age, we just became button pushers and we let the great machine feed us. Now we've all become sick from the baloney from Big Brother once again. Okay, and now if it's a time to retake it back and think about things clearly and educate, and need not medicate through healthcare reform if we all ate healthy food like hemp. Healthy eating made possible. Healthy eating made possible. Hemp, hemp, hooray. Okay, so if we educate, we don't need to medicate or even have healthcare reform because I'm not sick, and most of us have all that we need right here in our own backyards to stay healthy. I walk a tenuous line because I too could be sick someday. My empathy and compassion that goes out in my my thin veil of humanitarianism is such that I do have empathy and compassion for my sick associates and colleagues here in America. What are we to do? Do I take the burden upon myself because I'm educated and I eat well? And so then my tax dollars go in to create a public option that way? Or is privatization the way to go? I don't think that government can run a business effectively. It's been proven time and time again. Our country is $1 trillion in debt. We borrow money from the Chinese. What the hell gives us the right, or Big Brother, the right to think that he can take over and run healthcare for me? when he can't even manage our basic bottom line.
Do you think that the government runs other things well?
No, I don't.
Huh?
I don't think
You don't think Medicare and Medicaid work well?
Well, you know, Social Security. I mean, you know, what do I have to look forward to besides trying to maintain through preventative health and the right choices as an educated constituent here in democracy to need not get sick ever. But if I do get sick, injuries should be an employer obligated thing, and anyone that drives should be insured.
Well, what about the 9% of our population right now that's unemployed?
Probably more than that. I walk the line.
9+, yeah.
I walk the line every day. You know, hey, what's the easy fix here? We're not a socialist country, and we're not a country like India, where we have a certain amount of people that fall into a social demographic caste or a classification system, like the homeless population that's swelling on our streets in Portland. I mean, do we give everybody handouts? I mean, at some point in time, do the rich upper 1% pay for it all? Yeah, that's what I think. Why does it become a taxpayer-obligated healthcare system when it should be maybe a government-run, tax the rich, give it back to the poor? You know, maybe that's the best option. I don't know whether that's a public option or private option. To me, it's all convoluted political puppetry and hot air. You know, who's pulling whose strings here, and what special interest groups are pulling the tail on the donkeys? He goes, hee-haw, hee-haw, and we decide whether or not we want a carrot stick or a willow stick to try to manage the thing. And an overview about healthcare, even knowing that it is a highly debated consideration, I again try to not get sick.
Yeah.
But I think in America, because I have no free education system, I didn't have a bailout program, that hell yeah, I should have health care.
Yeah.
And it should be provided to me at a low affordable cost.
Yeah.
Like my great American diet of baloney and bullshit that got me sick in the first place. So come on, Uncle Sam. Green eggs and ham, something. Keep me healthy and wealthy and wise.
Yep.